So look, breast implant illness syndrome, or BII, is certainly a condition that I personally am seeing more commonly, and I'm sure most plastic surgeons are as well. We don't know, quite frankly, that much about it. It is certainly more commonly reported, certainly in social media and on the internet. It's becoming more talked about in forums. In terms of the evidence, there is certainly good evidence to suggest that there is a group of women with silicone breast implants who seem to get symptoms that we can't explain for. There's no robust scientific evidence to link silicone breast implants to these symptoms, but there is no doubt that there is an increasingly large group of patients who are experiencing these symptoms, although in my experience it's still a minority of patients who get BII. The evidence essentially is that if someone has another disease process or pathology that can cause the symptoms of BII, then usually removing their implants and their capsules, not unsurprisingly, doesn't do anything to help relieve their symptoms in general terms. But there is evidence to suggest that if there is no other issue that can cause the BII symptoms, then removing the implants in the majority of these patients does help to almost completely resolve their symptoms. And certainly, anecdotally, from what I've personally seen of my patients, that is the case. There's certainly no evidence that BII is linked to any form of cancer or any life-threatening disease process, but patients who come to me with BII are certainly distressed and severely affected by these very real symptoms.